This is a C. Jason podcast, and I'm Yumie Rhee from Yonsei University, Seoul, Korea. I am the corresponding author of the study. In this podcast, I'll briefly introduce the study with Namki Hong, the first author. Persistent elevation of parathyroid hormone after kidney transplantation, in other words, tertiary hyperparathyroidism, is associated with increased risk of cardiovascular morbidity, bone loss, and graft failure. Tertiary hyperparathyroidism may require parathyroidectomy when it is refractory to medical treatment. We wondered whether we can develop an easy-to-use integer score system to predict the risk of post-transplant parathyroidectomy. Based on a hospital cohort of 669 kidney transplant recipients, we identified top risk factors associated with post-transplant parathyroidectomy by data-driven approach using machine learning, which were all used to develop integer score system. Performance of prediction models and integer score was externally validated in multi-center prospective cohort, including 542 kidney transplant recipients. Namki, what did we find in the study?
Post-transplant parathyroidectomy occurred in 5% and 2% in derivation and external cohorts, respectively. Longer dialysis duration, higher intake parathyroid hormone, and higher calcium level at pre-transplant period were top-performing predictors among clinical variables. When integer score ranges from 0 to 15 was created using these three top-performing variables, individuals who underwent parathyroidectomy had higher median integer score, 13, compared to those who did not, 3 to 4. About half of individuals with high pre-transplant integer score over 13 underwent parathyroidectomy during follow-up, whereas parathyroidectomy was performed in about 2% of low-score group. A simple integer score showed comparable performance with top-performing machine learning models. Of note, at least 2 times of serial measurements of integer score during 12 months prior to kidney transplantation improved risk classification compared to single-time measurement. Dr. Rhee, could you conclude the study?
Thank you, Namki. I think this study suggested that simple integer-based score, particularly when measured serially, can be helpful for clinicians to assess and quantify the risk of post-transplant parathyroidectomy, which may help individualized approach.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.